Good afternoon, everyone, and welcome. It's a pleasure to have you all here today for this webinar on mixed method research bridging quantitative and qualitative approaches. My name is Cansu Polat Dünya from the School of Nursing at Istanbul University, and I will be co-moderating today's session. It's my great pleasure to introduce our guest speaker, Dr. Vishnu Renjith. We are pleased to host Dr. Renjith through the Erasmus program, whose collaborative style has made a meaningful impact on our postgraduate students. Dr. Renjith is a lecturer and program director at the School of Nursing and Midwifery at the Royal College of Surgeons in Ireland. He is a researcher at the Skin, Wound and Trauma Research Center and supervises postgraduate, doctoral and postdoctoral researchers. His work particularly focuses on qualitative research methodologies, evidence synthesis, and advancing nursing education. He has an extensive scholarly profile with over 75 publications, more than 90 invited presentations, and recognition among the top 2% of most cited research globally. He serves on the editorial boards of Plus One and BMC Nursing. And very recently, he has joined the editorial team of our journal, Crare Journal of Nursing. Mixed methods research asks us to hold both numbers and narratives at the same time and to let them enrich each other. I hope today's session opens new doors for your own research journeys. And now I would like to hand over to my colleague, Assistant Professor Sema Bayraktar. She is our Erasmus coordinator to get us started.
Thank you very much, Cansu. I'm Sema Bayraktar. I'm Erasmus coordinator at School of Nursing at Istanbul University. We are very happy to be with you today. Without further delay, Dr. Janet, please go ahead. It is your time for presentation.
Thank you so much, Dr. Cansu and Dr. Sema, for providing me this opportunity and inviting me for this lecture and as a part of my Erasmus mobility here at the University of Istanbul. And thanks everyone for joining for the session. For the next 1 hour, we will be dealing with a very hot topic in nursing research, that is mixed methods research. And my name is Dr. Vishnu Renjith. I am a lecturer and program director at the School of Nursing and Midwifery of Royal College of Surgeons in Ireland. And I bring you all greetings from the Royal College of Surgeons in Ireland on behalf of the School of Nursing and Midwifery. By the end of this workshop or the session, the participants will be able to define what is mixed methods research, understand the rationale of using mixed methods research, appreciate the purposes and application of mixed methods research, interpret the notation system, steps of undertaking mixed methods research, and the analysis and interpretation of mixed methods research. We will start with the first set of slides that is about an introduction to mixed methods research. As healthcare system is kind of increasing very complex, we have seen with the COVID-19 and the expansion of digital health, artificial intelligence, our research problems are also getting complex and complex. In response to these challenges, there has been a tremendous increase in focus of mixed methods research. There has been a steady increase in number of mixed methods manuscript published in nursing journals in the recent years. When we look at the PubMed about mixed methods research, in 2002, we had only 11 articles which were published in the PubMed, and whereas now in 2024, we had around 39,000 articles which was published in PubMed alone with a mixed methods research. So what exactly is mixed methods research? When you look at the research approaches, our research approaches were broadly classified into quantitative and qualitative research. Whereas from the past 1 decade, we are seeing lots of researchers which are being coming up with under the approach called as the mixed methods approach. And today what we will be doing is we will be exploring that mixed methods approach. So according to the classic definition by the Campbell and Jordan in 2010, the integration of both quantitative and qualitative research approaches in a single research study is referred as a mixed methods approach. If as a researcher, you are planning to combine both quantitative and qualitative research approaches in your single study, then it is referred as a mixed methods approach. And in 2009, Chedley and Tashakori, two prominent researchers in the field of mixed methods research, came up with an acronym for a mixed methods research that is called as MM research or MMR. So what exactly is mixed methods research? Research in which the investigator gathers both quantitative and qualitative data, integrates the two, and draws interpretation based on the combined strength of both the data sets to understand the research problems. So it is not just having two sets of data, but what we have to do is we have to gather the two sets of data, integrate them, and then we have to draw the interpretations based on the combined strength of quantitative and qualitative methods. Then we can classify our study as a mixed methods research. And the purpose of mixed methods research is in nursing, the mixed methods approach purposefully combine both quantitative and qualitative techniques to enable a multifaceted understanding of a nursing phenomenon. So here, this is an example. You can see a lady in that image. This is an example from the study which was published in the Burns Journal in 2014, where the researchers looked into the perceptions of women after their facial burns. So looking in the mirror for the first time after facial burns, a retrospective mixed method study. So here the researchers were interested in quantitatively assessing as well as qualitatively assessing the impact of having a facial burn injury. There has been a lots of confusion around two of these similar concepts. The first one is the mixed methods approach, and the other research approach is called as a multi-method approach. So what exactly is a multi-method approach? If the researcher uses multiple quantitative or qualitative methods in the same project, but the overall data are not integrated, then we call such type of studies as multi-method studies. So for example, I have interviews, I have observations, I have survey as a part of my doctoral project. However, these are all independent components, and as a researcher, I am not able to combine, or I am really not combining or integrating the findings from each of these plans. Then I would call my research as a multi-method approach. So when you call something as a mixed methods research. So mixed methods is a term that is used to designate meaningful combination or integration of quantitative and qualitative research methods in the same project. So for example, if you're combining both quantitative and qualitative research project and integrating them in a single project, then you call it as a mixed methods research. Otherwise, you will call them as a multi-method research. So what are the purposes of mixed methods research? Mixed methods research works are highly essential or highly useful when the concepts are new and poorly misunderstood. Sometimes we feel that neither qualitative or not qualitative is itself by adequate, or we feel that some amount of findings from one approach can be greatly enhanced with another approach, or else sometimes the quantitative results are puzzling and difficult to interpret. For example, when you evaluate the exam sheets of answer sheets of undergraduate nursing students, you find that a certain group of people are really not performing well, or there are a group of underperforming students in our batch. So as a teacher or as an educator, we might think that why the small group of people are kind of not really performing well in our classes. So what we can do is we can do a small qualitative research to give more meaning to that quantitative research. Why, despite of the same training, same clinical experience, same type of lectures, certain group of students fail in their exams. So that qualitative component will shed a lot of light to the quantitative component in our study. So this is one example. And what are the applications of mixed methods research? Even though the mixed methods research was started as a approach across diverse problem, when you evaluate the mixed methods research, we can classify them under 5 broader domains, like 5 broader domains that can be used, like in a domains that uses mixed methods as an approach. For example, if you are doing a studies on which are all the studies that utilize mixed methods research, first is instrumentation. We know that there are a set of tool development studies, and tool development studies widely use mixed methods research as a methodology. The second one is intervention development. For example, if you are developing a nursing intervention for a particular disease condition, or you are developing an educational intervention for the students, what we can do is we can interview them, then we can develop the intervention, and from the intervention you can go to a next phase and test it quantitatively. So that is one example of intervention development. Another thing is if we need to generate a hypothesis or test a hypothesis, mixed methods research is highly essential. Another widely used application is theory building. Theory building is that if you are a researcher who want to kind of develop a theory, so might be first what we will do is you will do a qualitative study, might be a grounded theory, and then come up with a beautiful theory, which could be a narrow range theory or a middle range theory. And then from in the next stage, if you want to quantitatively test that theory and to add more validity to that particular theory, you can do a mixed methods research. You can do a second phase of quantitative and do your mixed method study. The last group of studies are explication. Explication is that situation where you want to give a little more of explanation or little more of clarity towards your finding. For example, in your previous example, I've told you that when students are not really performing well in their academics, what we can do is we can do a little more of explanation on why they are not really performing and do a qualitative strand and see that how they are performing. So that area of research or that area of application is called as explication. So the 5 major study types or study domains in mixed methods research include instrument development, development of interventions, generation of hypothesis and testing, theory development and theory testing, which it's called as theory building, and to give a little more of explanation, or that is called as explication. What are some of the types of questions in mixed methods research? For example, in quantitative research, we have a quantitative type of question, and we may use a PIGO framework for a quantitative question. Whereas in terms of a qualitative research, we may use something called as a PEO framework, or the population exposure and outcome measure as a framework. Whereas in terms of a mixed methods research, the researcher will pose a question that can be only addressed with more than one type of data, because the overall question is so broad that neither quantitative nor qualitative is essential. And what we need is we need to ask both questions, that is a exploratory question and a confirmatory question. So the researcher may simultaneously ask one, that is quantitative question, that is exploratory question, sorry, qualitative question, that is exploratory question, and a quantitative question, which is a confirmatory question there. So this is an example of a mixed methods research, which was about self-image of patients with head and neck cancers.
a mixed method study. So the overall goal or overall research question was, how did the head and neck cancer patients perceive their self-image? What is the perception of self-image by patients who are being treated for head and neck cancers? So here, the researchers quantitatively assess the self-image of head and neck cancer patients, as well as qualitatively assess their self-image using interviews. So here, the researchers simultaneously asked both quantitative and qualitative questions. This is just a small introduction about the mixed methods research. Now we will see what are some of the designing challenges, or what are some of the areas that you have to be careful when you decide a mixed methods research project. So similarly, like in qualitative research, the most important decision in a mixed methods research is whether you want to use a rigid design or not. Are you allowing some amount of flexibility to your research? Do you want to go with step 1, step 2, step 3, step 4? Or else what you can do is you may proceed until step 2. Then based on the data, based on how the study is evolving, you can decide whether you want to deviate your study to a certain extent. So it is ideal that you may have a prefixed research design or a rigid design when you are a new researcher or a newer person to a mixed methods research, because it will give you some directions on how to proceed with the next phases of your study. However, if you are a researcher who is kind of very well versed with research, you know what to do, you are really confident in proceeding with the intricacies of undertaking a mixed methods research, then what you can do is you can use a flexible research design or a flexible research pathway. However, whether it is a rigid design or a flexible design, designing a mixed methods research initially may look like a rail track. It has got different paths, different directions, and so on. And as a researcher, the 3 key decisions that will help you navigate through this puzzle include sequencing, prioritization, and integration. I would like to repeat this: the sequencing, the prioritization, and the integration. Now we will see what is sequencing. Sequencing not just refers to nothing but the options of when you are collecting your quantitative data and when you are collecting the qualitative data. For example, you can collect qualitative data in the first phase, or else what you can do is you can collect quantitative data at the second time, or you can collect the quantitative data first or qualitative data first, or what you can do is you can collect both the data simultaneously or approximately at the same time. So if you are collecting both quantitative and qualitative data at the same time, we call these type of designs as concurrent design. Or when you are collecting, if they are not collecting at the same time, we call them as a sequential design. So sequencing in mixed methods research, you can have a concurrent design where you can collect both quantitative and qualitative together, or a sequential design where you can collect quantitative first or you can collect qualitative first. That is about our first decision, that is sequencing. The second decision in mixed methods designing is prioritization. Prioritization is that step where you decide which component of your study should be given the priority. If you are giving both of the strands equal priority, then you call the study as an equal status study. But one approach is given more weight, then you may say that as a dominant approach. For example, I am a qualitative researcher and my mixed method study is mostly a qualitative research with a small component of quantitative research. Then what I can do is I can give a dominant status to the qualitative study in my research. So as a researcher, you can decide on what type of a approach that you want to keep it as a dominant approach. So this is the key decision or the prioritization flow chart. Prioritization, you can give equal priority to each strands or an unequal priority. You can, in the unequal priority, you can prioritize either your quantitative strand or your qualitative strand. Then the third methodological decision is integration in mixed methods research. So here what we will do is mixed methods research achieve its full potential during integration or combining the results. So which are all the areas that you can integrate your study? You can integrate your study during data collection or data analysis or at the interpretation stage. So here what you can do is sometimes you may do it at only at data collection, sometimes you may do it only at interpretation, or sometimes you may do it only at the analysis. However, ideally you can do this at all the three phases. So integration, you can connect the data, you can embed the data, or you can merge the data. How we will connect the data? We can have a quantitative study, then a qualitative study, or you can have a first qualitative study, then a quantitative study. You can embed the research data. Here, what we will do is we will have a larger qualitative study. In that, we will have a smaller quantitative study, or we will have a larger quantitative study and a smaller qualitative study, either ways. And the third one is merging the data. We can merge the data during analysis or during the interpretation. Another area of focus while designing a mixed methods research is a notation system. Can you all see those example notations, 1, example notation 2, and example notation 3? This is a standard notation system that is used in mixed methods research. So the first, if you are seeing anywhere, you are seeing it as quant, it means the study is quantitative. Anywhere in the research report, if you see qual, it means the study is a qualitative study. And plus indicates there is a concurrent correction of quantitative and qualitative data. And arrow indicates the sequential collection of quantitative and qualitative data. Uppercase means a priority is given to that particular strand. Lowercase letters indicate that a lower priority is given to that particular strand. So here in this example, in the first notation, you can see that quantitative plus qualitative. Here, both of them are given equal priority because both of them are in capital letters. And the plus sign indicates that we are having a concurrent or simultaneous collection of both quantitative and qualitative data. In the example notation number 2, we have the first phase is quantitative. Since the quantitative is given for capital letters, it just means that the quantitative has a priority. And this will be followed by a qualitative research, which is a smaller priority. Or in the next example, you can see that there was a larger quantitative study with priority for quantitative and a smaller qualitative study, which is given on the brackets or the parentheses. Okay. So that is about the sequencing, priority, integration, and the notation system. Same like in quantitative research, we have randomized controlled trials, quasi-experimental trials, or a case control study, cohort study, and so on. Even in mixed methods research approach, there are different designs in mixed methods research. And the 4 designs are as follows. We will see each of these designs in detail now. The first one is called as a triangulation design. Here, the focus is about the central phenomenon of the study, and the purpose is to obtain different but complementary data. So here what we will do is we will collect both quantitative and qualitative data simultaneously, and both of the strands have given equal priority, we will converse them during the data analysis and data collection and in the interpretation phase. So a triangulation design is one such design where there are two components. One is a quantitative component and qualitative component, and both of these components have got equal priority and they are combined during the time of analysis and interpretation. So here you can see we have a quantitative phase, qualitative phase, you are mixing it and then you are interpreting the study findings. So this is the schematic representation of the triangulation design. So Nayak et al. Conducted a triangulation design to understand the self-image of patients with head and neck cancers. A self-interview and a self-image, self-administered self-image scale and structured interview was done. Both of the data were collected simultaneously and mixed during the analysis and interpretation stage of the study. So that is about the triangulation design. So second designs are called as embedded design. Embedded designs are those designs where we use one type of data as a supportive capacity to the other study. So either quantitative or qualitative can become the dominant. However, in most of these embedded design, qualitative is just supportive of the quantitative data. So the larger study would be a large quantitative study and a smaller qualitative study. So the notation can use parenthesis because it is an embedded design. So here it can be a larger qualitative study followed by a small quantitative study, or a large quantitative study followed by a small qualitative study. So this embedded studies are those studies where you are kind of embedding a smaller study on a big study, like, and then the embedded study will always have a lower priority. So in Chile, 2015 conducted a study to analyze impact of patient care technology on nurse-patient relationship. In this embedded mixed methods research, the study was conducted among 112 nurses and 115 participants. And this was the quantitative study, and the qualitative data were derived from semi-structured interviews with a smaller subset of participants. Means a smaller group of nurses and patients became the participants for the embedded study. So now we will look into the third design in mixed methods research. They are called as the explanatory designs. So explanatory designs are sequential designs, means that it will have phase 1 and phase 2. So here the phase 1 will be quantitative, explanatory. Explain means it is more related to a quantitative study. So quantitative data are collected in the first phase followed by the qualitative data in the second phase. Either quantitative or qualitative can become the priority. So if you look at the notation system, you can see that the quantitative is the first phase, then second phase is the qualitative, or you have the quantitative phase, then we will go to a qualitative phase. Here, you see that in the first example, quantitative is the first phase, and in the second example, qualitative is the second phase, or the qualitative has a higher priority. So this is the schematic representation, quantitative data collection. This is followed by mixing, and then you will have a qualitative research and interpretation. So mixing, why we say mixing here is based on the findings of quantitative research, we will be doing the qualitative research. That is why it is called as a mixing here, because the qualitative research will entirely depend on the quantitative first phase. So in example, Sahosuneni et al. Conducted a study to determine reproductive health education needs of adolescent girls. A mixed method study, that is sequential explanatory study, was conducted. The first phase was a cross-sectional study, which was conducted among 1,274 female adolescents. And in the second phase, 11 focus groups were discussed with the 77 girls. So you can see that there was a first quantitative study and a second phase qualitative study. So the last stage is just opposite to the sequential explanatory. They are called a sequential exploratory design. where whichever the way or the priority is, first phase is always qualitative research. So that is called as a qualitative research. So qualitative research will be the first phase, and those type of designs are called as exploratory design. So here you can see the notation system. Qualitative leads to quantitative. Again, qualitative leads to quantitative. In the first example, qualitative is prominent, and in the second example, the quantitative design is prominent. So here you can see qualitative phase, then mixing. Why we call it mixing here is the quantitative stage is entirely depending on the findings and the data collection from the qualitative phase. That is why we are just going like this: qualitative, mixing, quantitative, and interpretation. So this is called as exploratory design or sequential exploratory design. So Rahmani et al. In 2014 developed a premarital sexual behavior assessment scale for young women using a sequential exploratory mixed method study. In this study, the first phase was qualitative methods, and this was used to generate items. And in the second phase, that psychometric properties, that is validity and reliability, was assessed using the quantitative methods. So we have seen 4 major designs in mixed methods. That is, they are called as triangulation design, embedded design, explanatory design, and exploratory design. Triangulation means both of them have equal priority and converged at the end. Embedded design means you have a large quantitative study and a smaller qualitative study, or a large qualitative study and a smaller quantitative study. Explanatory and exploratory happens in phase 1 and phase 2. In explanatory design, first is a quantitative, then a qualitative. In exploratory, the first phase is qualitative, then a quantitative. So if you are kind of looking for a very good resource on how to write a mixed methods protocol, see this paper, which was published in 2014 at the Journal of Advanced Nursing. This is by Escola. So they evaluated the pediatric end-of-life care in home setting. That study is called as Pelican Home Study. You can review the paper, and this is available for you to in the journal website. We come to the last section of our topic today, that is about the data collection and data analysis. So here what we will do is we will do a variety of methods to collect the data. For example, you can have group interviews, individual interviews, psychosocial scales, observations, biophysiological measures, records, diaries, cognitive tests, internet postings, photographs, physical artifacts, any blood investigations. Any of such data you can use in mixed methods research. So basically in the quantitative phase, you will use lots of quantitative data collection techniques. And in the qualitative phase, you will use a lot of qualitative data collection techniques. Excuse me, I'll just take a little bit of water there. And when coming to the analysis, so if you ask me, the integration is the central feature of a high quality mixed methods analysis. However, researchers found that even though the integration is a central feature of a high quality mixed method studies, many of the researchers tend to report quantitative and qualitative separately without attempts to integrate the findings. In a systematic review, which was done by Beck and Harrison in 2016, they selected a good number of nursing journals and nursing articles, around 294 papers. And then they found that approximately around 47% of them didn't integrate the quantitative and qualitative findings, even though they say they have utilized a mixed methods approach. So it is highly essential that even though you say a mixed methods approach is used, you should be using a integration in your research study. So what is an integration? According to Creswell, the true integration happens when there is true integration. that integration produce a whole through integration that is greater than some of the individual qualitative and quantitative parts. So what Creswell say is that when you integrate the quantitative and qualitative strand, we will produce a final result that is much, much greater than the sum of the individual quantitative and qualitative parts, and argue that we all should do an integration when you are doing a mixed methods research. So this is an example of a study by Suzanne et al. In 2015 about a triangulation study which was done to describe the impact of chemotherapy-induced pain or CHIP. 10 women reported worst possible pain with a visual analog score of saying 8 to 10. So first part was a in the first section, or the first simultaneous task was quantitative. So there were many people, or 10 people, women reported worst possible pain. Then out of the overall 22 participants, 16 participants in the qualitative interview, and the 3 different categories were crystallized. So after the thematic analysis, that was perception of manageable pain, perception of pain beyond imagination, and perception of crippling pain. So it just means that the pain was might be in for one group of people, it was manageable. One group, it was pain beyond imagination. And those who had a higher score had a perception of very crippling pain. And the findings they have combined, and they have mentioned that we need to develop comprehensive strategies for mechanisms of CHIP or chemotherapy induced pain, and people with manageable pain needs one strategy, people with pain beyond imagination would need another strategy, and people with very crippling pain might need a different pain management strategy. Same like our t-test, ANOVA, or thematic diagram, or forest plot or funnel plot in systematic review. In the mixed methods research, we saw a group of tables, and those group of tables are called as meta matrix. So meta matrix is nothing but a table or a matrix form of arrangement of data. This can be only seen in mixed method studies, where the researcher tried to combine the quantitative and qualitative results in a single table. So that type of table is called as meta matrix. So here you can see that this is a study, and the study you can see this was, you have patient's pseudonym, age, sex, average hours of sleep, VAS visual scoring, that is VAS scoring of fatigue, and whether they are using sleep medication or not. So for example, here in the first example, you can see that the person is sleeping around 6 hours daily. The person has a current fatigue score of 9. It means that the patient is extremely tired, and the patient is not using the code number 1 for medication, means that the patient is not using any medical treatment for sleeping, for the purpose of sleeping. So here, even though the patient sleeps for 6 hours, the patient has a fatigue score of 9. So in the narrative or in the qualitative interview, the patient told, I never sleep throughout the night. I usually don't have problem or much trouble falling asleep, but I just can't stay asleep. There is never a day when I don't wake up exhausted. So here you can see that when you add the fatigue narrative, it just gives a lot of meaning to the visual analog score of 9. So why that patient was telling 9 as a reason there in the study. So this is an example of a meta matrix. So here we will see the second patient who sleeps only 5.5 hours, but has not much of a fatigue. Even though the Alex sleeps only 5 hours or 5.5 hours, he does not feel much of fatigue, and that is 5. And Alex is also not taking any medication. However, when you look at the Alex narrative, we can find that I have never really needed that much sleep. Ever since I was college, I get up by just a few hours and I am just fine. So Alex is a person who has been habituated to have less sleep. And even though he sleeps only 5.5 hours, he is not really having so much of fatigue. So that is the explanation for that VAS score. So when you have these type of quantitative and qualitative data, you can kind of merge them together using a mixed methods matrix and see how the patterns are evolving. And this is no single method for doing a meta matrix. It is up to the researcher on what type of a meta matrix you would like to adopt for your study. And another critical appraisal. So when you are doing a mixed method study, and if you would like to critically appraise a mixed method study before you submit it to a journal or before you submit it to your PhD panel, what you can do is you can use the tool called as the mixed method appraisal tool, or MMAT. And this is available free of cost, and you can actually utilize this MMAT as a tool to critically appraise the mixed methods research. So that's all about my today's topic. And what we will do is we will just I will unshare my slides and we will ask any questions. I'll just come back to that. Before that, I just wanted to give you 5 takeaway points from my session. That is, whenever you are doing a mixed methods research, have a clear rationale, and both phases need to be rigorous enough to draw the conclusions. You should have a good quantitative and qualitative strands. Having different approaches does not make a study as mixed methods. You need to integrate them, and integration is an indispensable part of a mixed methods research. And there should be a logical description of all methodological aspects in the study. And we know that contemporary nursing and midwifery practice covers a broad and complex spectrum of care, before conception to birth and to health and illness and to death. Both quantitative and qualitative methods can make valuable contribution to expand the body of nursing and midwifery. Hence, mixed methods research can be used as a valuable methodology in nursing and healthcare research. These are some of my references, and that is my contact details. However, I will stop sharing my slides now. We will be happy to take some questions from the participants.
Thank you so much, Dr. Renjith. We have some time for questions. You can't see on Zoom line. I will tell you now. And if you have questions, please type in and I will read that. And I will tell you for first question. Sorry. Yes. In nursing, the first question from Ülkü Baykal. In nursing, we have some problems about peer review process of qualitative research. Reviewers often adopt a quantitative approach when evaluating qualitative studies. So we have experienced many difficulties in selecting reviewers for mixed method research. Do you have any suggest for this?
Okay, yeah, that is a good question, because sometimes when you send your journal for a journal, when you send your manuscript for a journal,
Yeah.
they come back to you and say, we don't have reviewers for mixed method studies, so we are unable to review. Or as editors, sometimes we find it difficult to get a mixed methods research reviewers. So what approach I could use is I would kind of search for reviewers who have recently published mixed methods research, and might be ask them whether they can review the study as a mixed methods researcher, because they will be good at the methodology. They will know about the mixed methods research. And so that could be a good idea to, just look for authors who have recently published mixed methods research, and you can actually contact them.
Okay, thank you. I will check the questions again, sorry. And now there is no any questions. I think maybe if you write on the text, we will read again. It's okay. I think there is no question again. And thank you for everyone for attending for this season. Now, I would like to invite our Dean, Cansu Polat Dünya, to close our seasons. Please, Cansu, go ahead. Excuse me, sorry. Cansu, dear Cansu, please go ahead to close our session. Maybe there may be connection problem. I will ask on.
Yeah.
Sorry, thank you. Thank you, Dr. Renjith, for your valuable and insightful presentation.
And thank you, Cansu and Sema and the Faculty of Nursing at Istanbul University for giving me this opportunity. It was a great pleasure meeting you all. And thanks everyone for joining. One of my PhD scholar, Blessing, has also joined the session. Thanks, Blessing, for joining. And it was a great pleasure talking to you all. And wishing you all a very happy upcoming Nurses Week and an International Nurses Day. Thank you all so much.
Yeah.
Take care.
I will share a Nurses Week announcement for tomorrow for everyone. I think yes, it is. Tomorrow we have a Nurses Week. Please, you can join this Nurses Week. It is free. It will be held on Professor Dr. Cemal Birsel Conference Hall. And Dr. Vishnu will be with us tomorrow. He will make a presentation about Nurses Week, about why an Irish perspective. And then that's all. And I couldn't see any questions also yet. Do you have any question for closing, Cansu? If it's okay, we look forward to seeing you tomorrow. And thank you for everyone for attending for this season. Okay, bye-bye.
Thank you.